Your cat is not like a dog. She may not whimper, cry out, or make it obvious that something is wrong. She will simply change, quietly, gradually, in ways that are so easy to explain away that most owners do exactly that. She is just tired. She is just being moody. She is just getting older. But sometimes, those small changes are not personality. They are a message from an animal who cannot speak, cannot call for help, and has no way to tell you she needs you, except through the only language she has: her behavior. Today, we are going to go through 12 of the most important signals cats use when something is wrong. Some are obvious, some are almost invisible. All of them are worth knowing. No single sign on this list means something is definitely wrong. But if you recognize several, or if something has recently changed, please take it seriously. Sign number 12. She has stopped greeting you. You walk through the door, and nothing happens. No tail up, no trill, no appearance from the other room. For a cat who used to meet you at the door, that absence is worth noticing. Veterinary behaviorists note that a cat who consistently stops greeting behavior she previously performed regularly may be signaling a change in her physical or emotional state. Greeting behavior requires energy, motivation, and a degree of alertness, and a cat who has withdrawn from it is worth watching carefully over the following days. This is one of the earlier signs owners often recall when looking back after a diagnosis. Imagine noticing that your cat, who always appeared when you came home, had simply stopped. At first it seems like nothing, but looking back, it was the first thing that changed. If your cat used to greet you and has stopped, note when it started and watch for anything else that seems different. Sign number 11. Her voice has changed. You know your cat's voice, the specific sound she makes when she is hungry, the different one when she wants attention, the quiet trill when she is content. So when her voice changes, you will notice it if you are listening. Veterinary specialists at Cornell University's College of Veterinary Medicine have noted that changes in a cat's vocalization pattern, including new sounds, increased frequency, unusual yowling, or a cat who has become significantly quieter, can be associated with a range of conditions, including hyperthyroidism, hypertension, cognitive decline in older cats, pain, or respiratory illness. A cat who suddenly begins yowling at night when she never did before is not doing it for no reason. A cat who has gone unusually quiet when she was previously chatty is communicating something too. Both directions matter. More vocal than usual, less vocal than usual. Imagine a cat who has had the same voice for 12 years suddenly producing a sound you have never heard before. Not her normal meow, but something different and prolonged. That kind of change is worth a call to the vet. You know your cat's voice. Trust yourself when something sounds different. Sign number 10. She is drinking more water than usual. Cats are light drinkers by nature. Their ancestors obtained most of their hydration from prey. So a cat who begins drinking noticeably more water than before is worth paying close attention to. This is one of the more medically significant changes an owner can observe. Increased water consumption in cats, known clinically as polydipsia, is a documented early indicator of several serious conditions, including chronic kidney disease, diabetes mellitus, hyperthyroidism, and certain liver conditions. The American Association of Feline Practitioners recommends that any noticeable and sustained increase in a cat's water intake warrants veterinary assessment, as early detection of these conditions can significantly affect treatment outcomes. The challenge is that this sign is easy to miss. Cats drink quietly. They drink when you are not watching. And if you have a fountain or multiple water sources, you may never notice the change at all. One practical habit: briefly note the water level in her bowl each morning. If it is consistently lower than it used to be, that observation could be one of the most useful things you bring to your vet. Sign number 9. She is hiding more than usual. Your cat has always had her spots: the corner behind the wardrobe, the space under the bed, the shelf in the spare room. But there is a difference between a cat who retreats to her quiet places occasionally and one who has effectively disappeared into them. When hiding becomes the default, something may have changed. The American Association of Feline Practitioners identifies increased hiding behavior as one of the more reliable early behavioral indicators that a cat may be experiencing pain, illness, or significant stress. In the wild, a vulnerable cat hides to protect itself. The instinct to withdraw when feeling unwell is deeply hardwired, which is why a cat suddenly spending significantly longer in concealed locations is a sign that deserves attention. Imagine a cat who used to sleep on the sofa and now only appears briefly for meals, retreating immediately afterward. That shift, from visible to invisible, is the kind of change worth noting. Is she hiding because she is resting, or has she effectively withdrawn from the parts of the home she used to inhabit? That distinction matters. Sign number 8. She has stopped grooming herself. A well cat grooms herself. It is one of the most consistent things a healthy cat does, methodically, regularly, without being asked. When that changes significantly, it is often meaningful. Veterinary ethologists have documented that a notable decline in self-grooming can be a behavioral indicator of physical illness in cats. Grooming requires energy, flexibility, motivation, and a body that is comfortable enough to reach all its own surfaces. A cat who is in pain, severely fatigued, or systemically unwell may groom less, sometimes within days of the onset of the underlying condition. Signs visible if you look: a coat that has become dull, matted, or greasy, fur clumped around the hindquarters, areas that appear unkempt when they were always clean before. One way to think about it: grooming is one of the first things a cat may stop doing when she does not have the reserves to maintain herself. If your cat's coat has changed in appearance or texture, and you cannot attribute it to seasonal shedding, it is worth a conversation with your vet. Sign number 7. She is breathing differently. This one requires careful attention, because not all breathing changes carry the same level of urgency. Normal cat breathing is quiet, effortless, and almost invisible. Some changes are subtle and worth monitoring. Others require immediate action. Veterinary emergency specialists identify open-mouth breathing, rapid shallow breathing, labored abdominal movement during breathing, and audible wheezing or crackling sounds as signs that warrant immediate veterinary assessment. Unlike dogs who pant to cool down, cats do not normally breathe through their mouths. Open-mouth breathing in a cat at rest is considered a medical concern until assessed by a vet. The subtle changes to monitor: a slightly faster resting respiratory rate than usual, a small wheeze you only hear in a quiet room, breathing that seems slightly more effortful than normal during rest. If you want to track this at home, count her breaths per minute while she is resting and calm. A typical resting respiratory rate for a cat is generally between 15 and 30 breaths per minute. A consistently higher rate over several days is worth discussing with your vet. The urgent signs that cannot wait: open mouth, labored chest or belly movement, audible crackling or wheezing, blue or pale gums, any collapse or extreme weakness. If you see those, do not wait. Go to a vet immediately. Sign number 6. She reacts differently when touched. Your cat has always let you stroke her, along the back, behind the ears, down the side of her neck, and then one day she hisses, or flinches, or pulls away sharply from a touch that never bothered her before. Sudden sensitivity to touch can be an important sign of pain, discomfort, or tenderness, and is worth taking seriously. Veterinary pain specialists note that sudden onset aggression or avoidance in response to touch in a previously tolerant cat is one of the more consistent behavioral indicators of localized discomfort. Cats rarely vocalize pain directly. Instead, they may protect an affected area through avoidance, flinching, or defensive behavior when that area is approached. Other causes such as fear, stress, or illness can also contribute to changes in touch sensitivity. The location of the reaction can sometimes offer useful information. A cat who pulls away from a touch near her lower back, her mouth, or her side may be telling you something about where she is uncomfortable, though a vet assessment is always needed to understand why. Do not interpret this as your cat rejecting you. Interpret it as a change worth paying attention to. Sign number 5. She is using the litter box differently. The litter box is one of the most reliable health monitoring tools available to any cat owner. Changes in litter box behavior are among the earlier and more informative signals a cat can send. Cornell University's College of Veterinary Medicine identifies the following litter box changes as warranting veterinary assessment: going outside the box, straining to urinate or defecate, producing very small amounts of urine, blood in urine or stool, visiting the box far more frequently than usual, or avoiding it entirely. In male cats particularly, straining to urinate with little or no output can indicate urethral obstruction, a condition that can become life-threatening without prompt treatment. A cat who begins going outside her litter box after years of consistent habits is not being difficult. She may be associating the box with discomfort or finding the journey there more difficult than it used to be. Check the litter box daily. It is one of the most practical habits a cat owner can have. Sign number 4. Her eyes or third eyelid look different. Most cat owners have never heard of the third eyelid, but once you know what it looks like, you will recognize it immediately, and you will understand why it matters. Cats have a third eyelid, known as the nictitating membrane, that normally remains hidden in the inner corner of the eye. When it becomes visible, partially covering the eye from the inner corner, it can be a sign that the cat is unwell, in pain, dehydrated, or experiencing systemic illness. Veterinary ophthalmologists note that a persistent visible third eyelid in a wakeful, alert cat is generally worth investigating. Other eye changes worth noting: cloudiness or changes in the lens, unequal pupil sizes, discharge that is yellow, green, or thick, pawing at the eye, consistently squinting one or both eyes. Eyes can sometimes be one of the earlier places where changes in a cat's internal state become visible to an observant owner. Sign number 3. Her appetite has changed significantly. You know how your cat eats. You know how long it takes, how much she leaves, whether she finishes every meal or grazes throughout the day. Any significant departure from that pattern, in either direction, deserves attention. The American Veterinary Medical Association identifies significant appetite changes in cats as one of the more clinically important early warning signs across a broad spectrum of conditions. A sudden increase in appetite can be associated with hyperthyroidism, diabetes, or intestinal malabsorption. A sudden decrease or complete refusal to eat can indicate pain, nausea, dental disease, kidney disease, or hepatic lipidosis, a liver condition that can develop in cats who go without adequate food. a cat who eats noticeably less over several days, or one who stops eating almost entirely, needs veterinary attention, not a wait-and-see approach. Complete refusal to eat, or a major sudden drop in appetite, deserves prompt veterinary advice. Your cat's appetite is one of the most honest daily reports she gives you about how she feels. Read it carefully. And when it changes significantly, act on it. Sign number 2. She has lost weight without explanation. This is the sign many owners notice too late. Not because they are not caring, but because weight loss in cats is so gradual, so quiet, that it can become significant before it becomes visible. By the time you can see it clearly, it has often been happening for some time. Veterinary internists note that unintended weight loss in cats, particularly in cats over 7 years old, can be an early indicator of conditions including hyperthyroidism, chronic kidney disease, diabetes, inflammatory bowel disease, and cancer. Because cats can lose weight in ways masked by their fur. The most reliable way to monitor this is through regular physical assessment rather than visual observation alone. How to check at home. Run your hands gently along your cat's rib cage. On a healthy cat, you should be able to feel the ribs without pressing hard, but they should not protrude visibly. If you can feel every individual rib easily, or if the spine feels more prominent than it used to, your cat may have lost significant body mass. Imagine picking up your cat and noticing she feels lighter than usual, even though she looks the same from across the room. That difference, felt rather than seen, is exactly the kind of early change that is worth bringing to a vet. Check your cat by feel, not just by sight. And do it regularly. Sign number 1. Something has changed and you cannot explain why. And the final sign, the one that matters most, is also the hardest to define. She is not doing anything dramatically wrong. She is eating, mostly. She is moving, enough. She looks fine, at a glance. But something is different, and you know it. You have lived with her long enough to know her rhythms, her moods, her habits, and something in that picture has shifted. Maybe she is sitting differently. Maybe she is quieter in a way you cannot quite put your finger on. Maybe she just feels off to you in a way you cannot explain to anyone else. Veterinary professionals consistently report that owner intuition, what they describe as the "something is just not right" observation, is one of the most clinically valuable early signals they receive. Owners who know their cats well often detect subtle changes days or even weeks before those changes become measurable on clinical examination. That instinctive recognition should never be dismissed. If something feels different, trust that feeling. You are not being dramatic. You are not overreacting. You are doing exactly what a devoted owner does, paying attention to the animal who cannot speak for herself. Pick up the phone. Call your vet. Describe what you have noticed. If everything turns out to be fine, that is reassuring. If it is not, noticing the change early may matter enormously. That is the most important thing this video can leave you with. You know your cat. Trust yourself. 12 signs. 12 ways your cat may be reaching out to you in the only language she has. She cannot say, "I am in pain, I am scared, I need help." She can only change. And now you know what those changes can look like. So watch her. Really watch her. Not just a glance as you pass her in the hallway, but a few quiet minutes each day where you actually look at how she moves, how she eats, how she sits, how she sounds. That attention is not just love. It is the most practical thing you can do for her health. If this video helped you, Please share it with every cat owner you know. It might be the most important thing you share this week. Subscribe to Cat Code Relevated. We are here every week because your cat is always trying to tell you something. You just need to know how to listen.